I really need to know the patient's background, right? Do you have an autoimmune disorder or rheumatologic disorder where I'm going to need you to stop some of the autoimmune medications? That means that they may have a flare up after surgery. And so we need to create a plan, whether it's with me and their primary care doctor or the rheumatologist, on how their other pathologies are going to be managed when they're off of those very necessary medications. Looking at their pre-op pain medications, right? So, as Beth said, how do we incorporate that to minimize polypharmacy, but also knowing that they're going to probably change and or increase if you were managed with narcotics and muscle relaxers, migraine medications before surgery, knowing that we're doing some authorizations with surgery, right? That's the goal, and how to manage that. Also, making sure we have a lot of out of state patients. And so, for me to prescribe narcotics over state lines has proven difficult. So, making sure that the patient has a pain plan even prior to getting to New York City for surgery, right? Making sure that the patient has their primary care provider on board, or their neurologist, or their pain management provider to really take over once they return home. Um, I do see the patients with Dr. Greenfield. We clear the patients to travel home, and I do make sure that they have at least 2 weeks of pain medication to get them through if they need for their next appointment. But creating a pre-op plan, really preparing the patients for what to expect after surgery, I think, and I hope, has been really helpful to manage expectations when they're in the hospital. And I've had lots of patients tell me, you know, you really told me there was going to be a whole lot of pain, and that wasn't the case. And I love to hear that, because I'd rather give patients realistic expectations than sugarcoat what's going to happen and have them not be prepared. Of course, honesty is the best policy, at least for me. And so I find that when patients really understand what the process will be like, they can take control and they're more proactive, which is really nice.